Today, I'll be showing you how to do a complex wound dressing on my patient here. Before we start the procedure, we have to check the doctor's order and the nurse's note to ensure that we're doing the correct dressing on the correct area. When we go into the patient's room, we're gonna do hand hygiene. We're gonna introduce ourselves to the patient. Hi, my name is Sasha and I'm going to be your student practical nurse today, and I'm just going to do a little dressing change for you. Is that okay? Getting consent is very important. Once the patient has consented, we're going to ask, are you experiencing any pain at the moment? The patient isn't experiencing any pain, but if they were, we would give them their medication or get the RN to give them their medication and then come back again in 30 minutes and reassess their pain. For this patient, there was no pain, so we can go straight into the assessment of the wound. Now that we got our gloves on, we can remove the dressing. And when we're removing the dressing, we're pulling the skin taut. The first thing we're going to want to do when we remove the dressing is to take a look at the dressing, and we're going to be assessing tacos. So it's the type, the amount, the color, and the odor. For every dressing change, we're going to be assessing the wound. And for this patient, we can see some undermining that is packed with some packing strips. Right here, we can see some bone. This is what I think is purulent drainage. And there is some eschar, or also known as necrotic tissue. Now that we're done assessing the wound, we're going to be removing the packing strips, trying to avoid touching the wound bed. The materials you're going to need to irrigate the wound are your saline, your syringe. For this syringe, we can see that it's a 60 ml syringe and it has a catheter tip on the top of it. Another thing that you're going to need for your irrigation is a sterile bowl, but for the sake of this video, I do not have a sterile bowl, so I'm just going to pretend that my saline solution is the sterile bowl. This saline is new, therefore we do not have to lip it. Your doctor's orders will tell you how much saline they want the wound to be irrigated with. There's our 10 mils of saline. Since this syringe has a catheter tip on the tip of it, we are going to irrigate a little bit slower with less force so we're not damaging the wound even more. When we're irrigating the wound, we want to get in the tunneling or the undermining first in order to get all the gunk and bacteria, anything that could be in that wound, out first, because when we go in to do the waterfall technique, it'll take all that with it. Now that we're finished irrigating the wound, we are going to be measuring the wound, and to do this, we are going to be using our sterile swabs. They can come in different packages, but this is just the type that I'm using today. We're going to be measuring the depth of the wound at the deepest point. So once we can see how deep that deepest part of the wound is, we're going to be holding it and measuring it. So for this one, it's about 1 centimeter. Next, we're going to be measuring how deep the undermining goes. So we take out a different Q-tip and swab, and we're going to measure how deep that undermining goes. Then we're taking another swab and we are measuring the length at the longest point and the width at the widest point. Now that measuring the wound is complete, we are going to set up our sterile field and begin to clean the wound. Now that our sterile field is all set up and we didn't contaminate anything, we are going to put our solution into our sterile field. Within the doctor's orders, it is telling us that we are cleansing the wound with normal saline. Now we are going to be adding our saline to our dressing tray, and to do that, we are putting the label into the palm of our hand and pouring the saline a couple inches above, avoiding any splashing. The next thing we're going to want to do is we're going to take out all of our supplies that need to be sterile and put it onto our sterile field, which will include our sterile scissors that also come with our forceps, because we are going to need to take a little piece of our packing strips out of that container, which I don't have here. So we're also going to pretend that we took that out and put it on our sterile field. Another thing you're probably going to want to have on your sterile field is a sterile swab. When we pack that undermining that we have, we do not want to use our forceps to pack it in, because that can increase the risk of damaging the inside of that undermining. Now that I have taken off our old gloves, we are going to be putting on our sterile gloves. In this portion of the video, I'm going to show you guys how I put on my sterile gloves. This is my package. I got a small. I usually take a medium. So we'll see how it goes. Before we open the packaging, we're going to make sure that the package isn't damaged or old or expired. So I'm going to be pulling apart my sterile gloves. We can just throw them out like that, because the outside doesn't have to be sterile. So we're going to flip it open. So now we can see it's open like this. We're going to take our fingers and tuck it underneath. And then we're going to pull it open. Also, this is after we've already sanitized our hands. Our hands are clean. I'm taking my left hand and I'm pinching the cuff. Then I'm going to take my right hand and I'm going to try my best to wiggle it in. Not too bad. I'm gonna have to fix my pinky, but we don't fix it with this hand, because this hand is not sterile and this part of the glove is sterile. So we're going to use this hand, our right hand, and tuck our fingers underneath of this cuff like this. And then we're going to squeeze our hand into this glove. And then we're sterile and sterile. So we can take this and fix our pinky. We're all good to go. Now that I'm sterile, we can go and we can clean the wound. The way that we're going to clean the wound is we are going to take our 2x2, dip it into our saline or whatever's ordered, and we are going to dry it. We're not drying it fully, we're keeping it a little bit wet. There's different ways we can do this. We can do it like this. Then we're going to make it a pillow, a wonton, whatever you want to call it. Now that we have our wonton or pillow, we're going to clean from the inside in a circular motion. And we're only doing that once, and then we're throwing it out. We do that same sequence every single time, but a little bit further outside of the wound. So say we start in the middle, we go a little bit further. We only do it once, we throw it out, we get a new one. Now that the wound is clean, we're going to dry the wound. We're going to take our 2x2 and we're going to make a pillow or wonton or whatever, and we're going to do the exact same sequence we did when we cleaned the wound. So we're going to clean in the middle, throw it out, get a new one, clean it again a little bit further out until we get all the way to the peri wound, and then we're good. The next thing we're going to want to do is we're going to want to pick up our packing strip off of our sterile field, and we're going to grab it in our hand because it is still sterile. Like that. We can put our forceps down. We're not using those. Then we're going to pick up our soft swab. So the way that we pack the wound, first of all, my face would never be this close to the wound. We are not smelling the wound. We're going to be taking our packing strip. We're going to be packing the wound in a zigzag motion. You can see for this patient, it is a Tupperware container, so it is not going to stick. We're going to leave a tail out so that the wound doesn't swallow the packing strips. Now our wound is all packed. We're going to pretend it's packed. Now we're going to cover up our wound. We are going to be applying tape, and that is how we do a complex wound dressing change on our patient here, the Tupperware container. We're gonna take the cap off first. If the patient is experiencing any pain, we will stop. Solution. Okay. I'm taking my left hand and I'm tucking it underneath. No, I'm not.